Hi everyone, my name is Dr. Relief Jones and I'm an ophthalmologist here in San Antonio, and I've been thinking a lot about what's going on with the COVID-19 and wanted to provide some of my insights that I think you might find useful for yourself or maybe for a family member. So, some of you guys may already be friends of mine on Facebook, but this is going to be my first post onto my professional page. So this is going to be available to the general public, not just to friends on my Facebook page. So I'll jump right in. So some of you guys may know me already, but some of you may not. A little bit about who I am. I'm a graduate of Stanford University. I went on to the Duke University School of Medicine, where I earned my medical degree. While at Duke, I spent 1 year doing full-time research in a biomedical engineering laboratory. One of the big reasons I did that was because I wanted to learn to approach medical problems with the mindset of an engineer, not just that of a physician. I graduated from med school and I immediately went to the Harvard Med School, where I did a postdoc research fellowship in immunology. This was followed by my internship year at Tulane. My internship year was what's called a transitional internship. We did a combination of internal medicine, pediatrics, and emergency medicine. This was followed by my residency in ophthalmology at the University of Texas in San Antonio, Texas. I then went on to complete my subspecialty training in glaucoma at the Harvard Medical School. So this is a little bit about me, my background. Before I get started, I would like to say that I have no financial incentives. I'm not being sponsored by anyone to give this talk. I'm not a speaker. I don't receive any type of financial remuneration for what I'm about to say. I also would like to give this disclaimer that this information that I'm sharing is based on my own personal background as both a medical researcher and a clinician. This information should not be taken as medical advice. You should always consult your own physician before incorporating any of what I say into your daily medical routine. So I just wanted to get started by asking some simple questions. Number one, what is COVID-19 and how does it infect us? I'll be telling you a little bit about this during my presentation. I'll also like to delve into why does it seem to affect some populations more than others? We've heard in the news recently a lot about African Americans being affected by this disease more than other populations. I have some theories on that. What can we do about this to save more lives? So I will not hesitate to tell you that the things that are being, encouraged are critically important. Maintaining social distance. This is just critically important. 6 feet from other people, especially when out in public. Keep objects and surfaces clean with disinfectants. You want to wash your hands frequently. And please don't touch your eyes, nose, or mouth, because in reality, this virus is not going to infect you through your hands. It's going to infect you through these three orifices, or these three areas of your body. Essentially, I've seen people out in public wearing masks, wearing gloves, touching things in stores, and then they'll take their gloves and rub their eyes, they'll pull their mask down, rub their nose. This defeats the purpose of wearing gloves or even wearing a mask. So please, I emphasize, don't touch your eyes, nose, or mouth. So I want to delve a little bit into how the virus infects cells. And so here what I've drawn is a cell, and I've drawn a little receptor on the surface of the cell. This is an ACE receptor. And this is the receptor that's used by the coronavirus to attach to the surface of the cell. The viruses have 4 different proteins on its surface, one of which is called the S protein or spike protein. The spike protein attaches to the ACE receptor, And that allows the fusion of the bilayer of the cell to fuse with the bilayer of the virus, which then allows the RNA that's in the virus to be injected into the cell. And so this virus will hijack the normal machinery of this healthy cell, and it'll allow the cell's machinery to read this RNA and produce a bunch of additional proteins that are then used to create replicas of itself, a bunch of viruses. So in the end, what you're going to end up with now is a cell that's filled with tons of viruses. Eventually, these viruses will overwhelm the cell. Sort of like the movie Aliens, they will burst out of the cell, killing the cell, but now allowing a bunch of new viruses to spread to other healthy cells to duplicate this process all over again. This is not good. So sometimes time is of the essence, because as this process continues, it's like a big snowball effect. So, I mean, the first thing, an ounce of prevention is worth a pound of cure. So doing all the things to prevent yourself from being infected is critically important. It's probably the most important thing. But if someone is infected, we have to start thinking about number 2, blocking the virus from entering the cell. So one of the things that can happen here is that we can have a molecule that interacts with this ACE receptor that prevents these spike proteins from attaching, and it prevents the virus from invading the cell. We could also, see scenarios where you might want to attack the cell or stop it from replicating once it has invaded the cell. So there are some very well-known potent inhibitors of virus replication, especially for coronaviruses. And one very potent inhibitor is zinc. Yes, zinc. The problem is, though, is that zinc, having 2 positive charges, has great difficulty penetrating the cell where the virus has infected to stop it from replicating. So this lipid bilayer doesn't stop the virus, but it stops the main inhibitor, zinc, from entering the cell. So there's a way to get by this problem. You can use what's called an ionophore. And so I like to think of an ionophore as like a little Pac-Man. And this little Pac-Man has an open mouth on the surface of the cell on the outside, which allows zinc to enter. It will then close. It will carry the zinc across the lipid bilayer, and once it's on the inside part of the cell, it opens up again and allows the zinc into the inside of the cell, where it can have action against viruses like the coronavirus. So the next question is going to be, how can I get zinc ionophores? How can I get some of these little Pac-Men to come to the rescue to take the zinc and help it to cross this lipid bilayer? Well, I'm sure you've heard a lot about chloroquine. This is something that's been talked a lot about on television recently. This is a medicine that was used predominantly for the prevention or treatment of malaria. It was found to be very toxic. It's not something that we use a lot of here in the United States. Its cousin, hydroxychloroquine, though, is infinitely safer than chloroquine, and it's used routinely for the treatment of tons of different rheumatologic diseases and, believe it or not, a number of ocular diseases. As an ophthalmologist, I see tons of patients on hydroxychloroquine. We have patients who develop scleritis, and this is probably one of the most common eye problems that people with rheumatoid arthritis get. Treating this with topical eye drops is typically not very effective. So we send these patients to the rheumatologist. We do the same thing for patients with Sjogren's syndrome. These patients are started on hydroxychloroquine, by the rheumatologist, and they are followed by ophthalmologists, because probably the most common side effect, negative side effect of hydroxychloroquine is that it can cause a toxic maculopathy. We call it a bullseye maculopathy because of its bullseye appearance on the retinal examination. It's very rare. We do baseline eye exams to check patients before they're started on hydroxychloroquine, and then we continue to follow those patients to make sure they're not developing any ocular toxicity. It's truly a lot of times the ophthalmologist who lets the rheumatologist know that the medicine's causing a problem and it needs to be stopped. The American Academy of Ophthalmology states that we typically don't have to check these patients again for toxicity until 5 years later after they've started the medication. Most ophthalmologists still check the patients once a year, but if we're not really having to check these patients for 5 years, and these patients are taking this medicine every single day, this tells you that the risk of this maculopathy is quite low. Some people have talked about some of the cardiovascular side effects. Again, cardiovascular side effects are quite rare when you're using it at the regular dosages, usually about 200 milligrams twice a day. This cardiovascular problem, QT prolongation on an EKG, is a little bit more common if higher dosages are used right off the bat. For example, if you use 400 milligrams twice a day, then you have to worry a little bit about the cardiovascular risk factors. But using it at the more regular dosage of 200 milligrams twice a day, cardiovascular side effects are quite rare. Probably the next thing, or probably most common thing you're going to look for is the ocular side effects. Like I said, which in my entire career as an ophthalmologist, and I've been practicing for about 15 years now, I can count on maybe one or two hands the patients that we've had to stop hydroxychloroquine on. And so I also understand now that this medicine is in short supply right now. So that's the other side of the problem. There's really not enough of it to go around to treat all the patients who need it for rheumatologic conditions, but at the same time to treat patients who are dealing with the coronavirus. And so I've seen situations recently where people who have positive COVID-19 tests and they are not able to be put on hydroxychloroquine simply because it's on back order. There's no access to it. And this happened, recently to a very good friend of mine, actually to his mother. And so this prompted me to start looking for maybe other medicines that can serve as an ionophore like hydroxychloroquine to help these zinc molecules to cross that lipid bilayer. There aren't a lot of other medicines that I could find. There are some other antibiotics that are typically used in feed animals to help them to grow. But I did find one supplement that was shown to be a great zinc ionophore, quercetin. This is a flavonoid. It's found in the skin of apples and the skin of grapes, and it's available at just about any health food store. As a matter of fact, I bought some today. So going back to my picture of the lipid bilayer, getting zinc from the outside to the inside, there are two great ways to do this: hydroxychloroquine or quercetin, a nutritional supplement. I wanted to provide a little bit of evidence for the things that I'm stating here. This is one journal article. You can see these are peer-reviewed journal articles. This was from nature.com. It was published in the journal called Cell Discovery, and it shows that hydroxychloroquine, a less toxic form of chloroquine, is effective inhibiting, this was the coronavirus 2. And so many of the same coronaviruses will, they'll be able to be killed in a similar fashion using similar drugs. I also wanted to pull up the article where I found that zinc or quercetin can serve as a zinc ionophore. And so this was also a peer-reviewed journal article. It was found in the Journal of Agriculture and Food Chemistry. So there you have it, quercetin. So we now know that zinc is critically important. We also know that getting the zinc across the lipid bilayer is critically important. So I wanted to now launch into the second part of my talk, which is who's at greatest risk for COVID-19. And I tell you, this part of my presentation may shock you a little bit and may provide you some really useful insights. So I left this blank for a reason, and you'll see why. So patients at risk can include patients on TPN. This is people who are getting their nutrition through an IV. The malnourished, patients with anorexia, or even severe diarrhea. Patients with gut diseases like celiac disease, short bowel syndrome, ulcerative colitis, or even Crohn's disease. What about alcoholics and those with liver disease? We've heard a lot about patients with chronic renal disease. Patients with sickle cell disease and hypertension. Older adults. Yes, I mean, all of these are people we would think of as being at high risk for COVID-19. Vegetarians. Why did I put vegetarians on this list? Maybe there are some young healthy people out there, and I say healthy, they think they're healthy because they're vegetarians. I'll just divert for a few moments because my wife and I were pescatarians for about 6 years until about 1 year ago. We both started to develop lack of energy, some other issues, and I knew for a fact that it was probably due to the fact that I had altered my diet so dramatically. I immediately went back to adding some chicken, maybe very small amounts of lean beef to my diet, but my wife was very reluctant to change her diet from her pescatarian diet. So I had to prove to her that she was potentially nutrient deficient before she would make any changes. So I ordered a test called a micronutrient analysis, which looked at things that typically were not checked for in regular medical blood work. And I found that she was deficient in 8 different things, including one very important thing, zinc. And so her pescatarian diet had potentially made her zinc deficient. I'm going to put a red circle around sickle cell disease and hypertension because these are diseases that disproportionately affects African Americans. Sickle cell disease almost uniformly in African Americans, and the highest rates of hypertension, African Americans. So there's my trick. That was not a list of risk factors for COVID. These were all risk factors for zinc deficiency. Take that in. Risk factors for zinc deficiency. Why are patients with hypertension at risk for being zinc deficient? I just couldn't get my head around that, so I had to do a little bit more research. So I think hypertension, again, might be one of the big reasons why African Americans are at higher risk for poor outcomes with COVID-19. The most common drugs used to treat hypertension are diuretics, in particular thiazide diuretics, things like hydrochlorothiazide or HCTZ. What's the problem with this drug? Well, thiazide diuretics cause an excessive loss of zinc. So we probably don't realize that by treating someone's hypertension, we may also be making them zinc deficient. This is critically important. Here's why. We have a canon, hydroxychloroquine, or if you can't get it, maybe the over-the-counter supplement quercetin might work to some degree. So you have the canon, but the canon is not useful without cannonballs. You need zinc to make this work. And I've seen some people going out and buying zinc, but again, I think if you're taking supplemental zinc, it's the same as having cannonballs without having a cannon. So you need to have something to help get this zinc across the lipid bilayer. So if you're not really, positive on a test for COVID-19, you definitely don't need hydroxychloroquine. No doctor should write it for pure prophylaxis at this point. But quercetin, you can buy at a health food store for about $20. So here's another problem I've seen. As I told you earlier, we doctors don't always check someone's zinc levels. Not routinely, not when they have COVID-19, not when they're deathly ill, on a ventilator with COVID-19. So the reason that is they're not really great biomarkers to check for zinc deficiency. So zinc levels are typically not assessed. The only way I've ever seen it is on this spectrocell micronutrient analysis, which I've done in my clinic a number of times, and I find it useful. It's not the quickest test. It takes a little bit of time. It needs to be mailed out. We need to wait for it to come back. I typically have to go online to get the results, but I'm hoping that some hospitals, some laboratories might be able to do zinc levels without doing this, more in-depth analysis. So I'll go back to my overview slide here. Emphasize again, prevention worth a pound of cure. Blocking the virus from entering the cell is one strategy to have a better outcome with coronavirus. Killing the virus by blocking its ability to replicate its RNA, producing replicas of itself to then infect other cells. In reality, the ideal solution is to have a vaccine, but we don't have that today, and we may not have it for a year. So until a vaccine is available, this is what you will find on my kitchen counter. And again, I don't want to, tell you what to do without first, you really need to consult with your physician. But my family, we're using some supplemental zinc right now, quercetin, and vitamin C. Once again, I thank you for tuning in. I thank you for watching my video. I hope you find it helpful. Please talk to your physician about some of the things you may have heard here. If you are a physician, please go ahead and take a look at some of the things that I mentioned. If you're a physician that's taking care of COVID patients, please take a look at what I'm writing here. I think it's going to be critically important for helping to get patients through this epidemic without dying, with better outcomes. Thanks once again. You have a great day.